निदानं तिक्तोष्णकषाय अल्परूक्षप्रमितभोजने धारणोदीरण निशाजागरात्युच्चभाषणै प्रियादिशोकं धीशोकं like that, so it continues. So it could be Vadika Pratishyaya. The better line is you can initially you can do the you can opt the medicines like Balajiragadi or Nayopaya. Balajiragadi can be the first option in this type of condition. Then go for any type of Vadasamana Rasayanas, probably like the Agastya Rasayana or what is our another one is even Kushmanda Rasayana. Agastya Rasayana will be sufficient. That could be the best.
Sir, Shwasa Kutara Rasa, Lakshmi Vilasa Rasa, and Vyoshadi Vati, where can we use?
I think you have got another class with Rasaushadhi, so better you will be dealing that.
Okay. Sir, also one last question. Sir, what can be done for reoccurring nasal polyps even after the surgery, which is associated with sneezing in the morning?
We have to take care of the immunity. That's the only one thing what we have to do. Better to keep away from the allergic conditions, and then always, but even though whatever it may be, there are possibilities to recurrence. So again, Pradishya Vardhane, that's what the indicate the disease itself explains. Anytime there can be a perturbation, and at any time there can be what we say a reduction in the body immunity also. So always be specific or be particular to maintain the proper immunity. That is the only one thing what we have to do.
Sir, that's the end of the questions that has appeared in our chat box. If any of our participants who wish to ask any questions, you may do so. Please be fast. Yes,
You
Doctor.
can contact me in any. I shall type my number here. You can contact me in any type of. You can through WhatsApp if needed.
Okay, sir. Yes, Dr. Jyoti, you can ask.
Yes, sir. Good evening, sir. It was a wonderful session. I had a patient, age she is 28 years now, and she is having a recurrent cough, and from since 1 month she is having a dry cough and slight fever she is having. But she is not having any tubercular history or anything, but she is having cough, and in X-ray it shows prominent bronchovascular markings. So, what should we think according to Ayurveda and the treatment?
Can you explain once again, madam? Yes.
Yeah, patient, lady patient is there, 28 years old. She is having chronic cough from 1 month. 1 month, and I had an X-ray, and X-ray shows prominent bronchovascular markings.
Okay.
So, what should be the treatment according to the Ayurveda? What should we think?
Bronchovascular marking in the sense, that's what I didn't understand. Whether it is fibrosis, you mean?
Yes, sir.
Yeah, if it is fibrosis, then it would be better to consider it as a Vadika Swasa, Vadika Kasa.
Okay, sir. Okay, sir.
Fibrosis is nothing but it's a Gharaguna Pradhana.
Okay, sir. So, sir, what should we give?
Initially, you do, as I explained previously, initially better to do the Padana. Then go for Snehapana with Vadasamana Grada, like as I explained, Rasna Dasmuladi Grada, or even Induganta Grada, you can go for, even Shatpala Grada, you can do that. So then do a proper Snehapana with that. Then go for a Virajana with Avipati. And later do the proper Samana with any of the Vada Samana, like Amrita Prasha Grada, etc. you can use in this condition as a
result. Okay, sir. Thank you, sir.
Dr. Ujjwala, you can ask.
Hello, sir.
Yeah.
Sir, I have discussed that case na Vata Pitta Kasa and Grahani Dushti. So, what Gruta we can give, sir, in that case?
Indugandham is the best option.
Okay, sir. Thank you.
Neha Sahu, you can speak.
Yeah, ma'am. Sir, what we can give treatment in pneumonia in child? Hello, sir.
That's what I said. We cannot make a protocol by knowing the simple name itself. We need to note the symptoms in detail, and especially in children, etc. It should be dealt with very what we say, particularly we should be very careful regarding that. We should analyze the dosha vikalpa particularly. So the complete symptoms with increasing and exacerbation for increasing the relieving factors, the duration and everything, the history, etc. Everything need to know. Then only we can develop a protocol. That's why simply pneumonia can
Sir,
be, as I explained,
can we give woman?
the Tamakashwasa can be presented with many symptoms. It can be, there can be Vadika Tamakashwasa, there can be or bronchial asthma itself, there can be Vadika bronchial asthma, there can be Vaitika bronchial asthma. So, like that, the pneumonia can be Vada predominant, it can be Pitta predominant, it can be Samavastha, it can be Leenavastha. So, but you need to know the details.
Sir, that occurs every year.
Every year pneumonia occurs.
Yes, sir.
You may have to consider it as Kshayaja Kasa.
Okay, sir.
That would be the best line.
Okay. Okay, thank you, sir. Good night.
So any of our participants again who wish to speak, you can do so be fast. Or else we'll wind up the session here. Yes, Dr.
Madam,
Rajat. Yes.
One patient complaining of recurrent sneezing in the morning, and I have tried with Haridra Kanda and Dashamula Katutrayam. Whenever the patient takes medications, at that time it got relieved, and after stopping the medication within 3 or 4 days, again it will start, sir. What should be the treatment protocol for this, sir?
Sir, in such conditions, again, if the conditions are recurring, always better to go for a Snehapana and a mild Shodhana followed by a Rasayana. Only the Alpa dosha and Madhyama dosha can be treated with Pajana or Langa Shamana. If the dosha avastha is Prabhude Shodhanam Taddi, we need to do the Shodhana itself. Then only we get a, especially in type of recurrent conditions, Punaravartaka Jara, etc. This can be considered as Punaravartaka, the type of Punaravartaka Jara. So just we need to do the proper systemic purificatory therapies. Then only we can get the patients.
Whether Nasya will be more helpful
I don't think so, sir. In such conditions, I don't think so. Nasya will be effective.
Okay. The Virechana is the best.
The better option will be if the Roga Bala is normal, you can do this. Vamana is the best option. If the Roga Bala is less, Rogi Bala is less, the Virechana will be the best option.
So, which is the preferred Gruta for Snehapana?
In this condition,
Yeah.
Then you the previously the rhinitis, I think this Indukanta will be sufficient.
Okay.
Especially Vadamaya Kshaya Mahodara Gulma Suram, Nimnonada Juraharam, relieving and relapsing type of fever. So always Indukanta will be the best option in this type.
Thank you so much. Thank you, sir.
I hope there are no further queries. So we'll wind up the session here. Before going into the wind up session, I request our participants to please give away some feedbacks regarding the session. We would love to hear from you. Although we have got a lot of feedbacks in our chat box, sir, I request our participants to please give away some feedbacks. Just unmute yourself and give away.
Thank you so much, sir. It was a very wonderful session, and your knowledge on the yogas are very much appreciated, sir. Because the more yogas we know, we have more confidence to practice, and you have given so much knowledge regarding the yogas on respiratory tract diseases. Thank you so much, sir.
Thank you, Dr. Rajat. Anyone else? Dr. Ujjwala?
Hello, sir. Very wonderful session, sir. I have heard you before also in dermatology section of natural day wellness. That
Oh, is
time
it?
also, yes,
Dermatology.
sir. Yes,
Dermatology.
sir. Yes, that time also you have presented the cases of your clinical cases. That also. So I have seen your name in this session, and again I have joined this
Oh,
session.
that's a great honor. Thank you.
Uh-huh. Thank you so much, sir. Thanks a lot. You have explained very nicely. Thank you so much.
Thank you, Dr. Ujjwala. Anyone else who wish to give us a feedback? Yes, Dr.
Yes,
Swati.
doctor. Hello, ma'am.
Yes.
Good evening, sir.
Yeah, good evening.
In each and every participant's case, sir had explained very nice, and we are having good confidence after attending this session. Different kalpas we came to know, and different line of the treatment and Vyadhi Avastha. So we can do good for the patients. Thank you, sir.
Try to reduce your number of medicines in the prescription as much as possible. That's the one. That's my intention.
Very nicely explained. Thank you, sir. Thank you very much.
Thank you, Dr. Jyoti. Yes, Dr. Swati. Swati, you can speak. Divyashri.
Good evening, sir.
Yes.
Hello. Am I audible, sir?
Yeah,
Yes, yes.
sure. Sure, madam.
Yeah, this is my third series along with Dr. Jasul, sir. I think all sessions were really good, and I can say this is the best session I've ever attended. As you said in the beginning, you're going to be more practical, but as you proceeded with the session, absolutely it was practical only. But the theory, whatever you told, it was like, yeah, I can understand how much depth of Ayurveda knowledge you're having. And when coming to the yogas, it was like I never analyzed in this way, like how you compared the yogas and all. I can say this is one of the best sessions I've ever attended, so thank you so much. We'll be looking forward for further sessions of you, sir. Thank you so much, sir. And thank you, ma'am.
Thank you, Doctor. So we'll wind up the session here. So once again, from the bottom of my heart and on behalf of Ayurveda Map, I thank you, sir, for this wonderful session. Thank you so much. So to the participants also, thank you for being a part of Ayurveda Map and for attending today's session. So we'll be meeting you again on Monday with another wonderful session. So till then, take care and good night.
Thank you, sir. Thank
Good
you.
evening, madam. Excellent.
Good night.
Thank you. Thank you.
मम्मी आई लेते हो